Hey everybody, I've been getting a lot of questions lately about breathing practices. So I thought I would just jump on for a minute and do something really quick on foundations of breathing. So our primary muscle of respiration is the respiratory diaphragm, and it attaches to the periphery of the ribs and up into the base of the spine. And it attaches in the center to itself, to its own central tendon, and moves inferiorly as we breathe in, which is why our belly expands and our organs are moved downward a bit. So again, we breathe in, and that diaphragm kind of comes in on itself and moves downward. So I'm always asked about breathing practices and yoga breathing practices or somatic breathing practices and what are some good breathing practices. But I think more foundational than that, prerequisite of any breathing art or practice is an understanding of really basic respiratory physiology, that our brainstem decides for us the best rate of our breathing based on an analysis of our blood gas chemistry. And if we can just remember that and relax and undo unnecessary tension around breathing right, this idea of breathing correctly or improving our breathing. If we can undo the tension around anything that might interfere with just relaxing into our normal breathing, not restricting unnecessarily the muscles of our back and our abdomen, the muscles around our rib cage, the muscles around our throat and neck and upper shoulders. If we can start with that as a foundation, I think that we will need less effort or attention to breathing practices. And I'm not saying in any way that you shouldn't do breathing practices or that it's not good to experiment with that under the guidance of an experienced instructor. But I think that there's a prerequisite to that. I think that there's this foundation of misunderstanding about the way that our bodies naturally adjust our breathing rate and rhythm and depth to what our needs are based on an analysis of our actual blood gas chemistry at any moment. So I think that's an interesting thing to look at. I also like Blandine, Calais-Germain's work and Donna Farhi's work on this idea of understanding the anatomy of the respiratory musculature and undoing this kind of tension before we start with layering on the breathing practices. It's kind of undoing before doing. And maybe I'll speak more elaborately on that in the future, but I just thought I'd throw that out there and see what people thought about that. Thanks.